general primary care doctors and general surgeons by 2030, yeah. So, and that's even before they consider whether the government take over the healthcare system. We've seen a lot of doctors in this country, sort of 50, 55, retiring early because of Obamacare. My husband's own primary care doctor sent him a letter last year and said, all of this electronic health records, all of this stuff, I can't practice medicine anymore, so I'm going to just retire and do my own research and things. We're seeing that so often, that when government gets involved determining, you know, you have to have electronic health records. You can't look at your patient because you're working on your computer. And there's a relationship there that's developed. So there will be a shortage, and that shortage will be even greater. So I think it's incredibly worrying about our supply of doctors. And under single payer, in Britain right now, there's a shortage of 100,000 doctors, nurses, and people who work in hospitals. The British government tried to, you know, bribe doctors who'd left England because of the National Health Service and how little they were paid and how long they worked, and tried to bribe them with money to come back. And the response was virtually nothing. Just a few docs came back because doctors aren't paid very well. In the UK versus the US, and in the US versus in Canada as well. Our doctors are well paid. They do have, you know, debts, and it is expensive, but, you know, over time they make good money, they save people's lives, and I think we don't want to destroy that great incentive.
Right. Earlier in our conversation, you talked about the number of MRI machines and the cutting edge treatment, if you will.
Right.
Does that exist in Canada and the UK like it does in America?
No, absolutely not. So, because when the government, each of the provincial governments the 10 provincial governments controls what's going to be spent on healthcare. So you see reports, stories from radiologists saying, our equipment, our x-ray equipment is so old, we don't even think we can rely on the results. But if you think the average wait in Canada for an MRI is 22 weeks, that's over 5 months, and the fact that Canada has 16 MRI machines for every million people, and it is a large country with only 37 million people, but 16 MRI machines for a million people. We have 44 machines for every 1 million people, and countries in the Eastern Bloc have, you know, 20 to 24, more than Canada. I mean, Canada is a highly industrialized country. Isn't it a shock that you can't get access? And I think the number of positron emission tomography machines, which are even higher, a higher level of machine than the MRI machine, very, very few in Canada. Whereas here, you know, if you've got cancer and they've discovered something, you will get a PET scan.
One of the darker parts, if you will, of the book, you discussed the assisted suicide and the death panels, and
right.
I found that to be very interesting and quite honestly a little depressing.
Yes. Yeah.
What? Tell me about that.
Well, remember when Sarah Palin was
Yes.
running and she was on the beach, she talked about ration care and death panels. I don't like to use the word death panels too much because it sort of scares people. But it really is, they are death panels. It's ration care because government is determining who is going to get care and how much care. And so in Canada, in many cases, people are told, you know, well, you know, you're not going to be able to get better, you're older, you should have assisted suicide because it'll be cheaper for everybody. And of course that's not the American way. The relationship should be between the doctor, the family, and the patient. And so once you start government getting involved, in the UK, for example, they have NICE. And it's not a NICE division within the NHS. It's the National Institute for Health and Clinical Excellence. NICE has a division which figures out what is the value of your life and what is the cost of the treatment or the pharmaceutical. It's called quality adjusted life years. And so if the NICE, the government board, decides that you're retired, you're worth $30,000, but you know you could be cured with Hep C with a drug that costs $80,000. But because you're not worth that, you're not going to be able to have access to it. And this is what I fear will happen in the U.S. under ICER, you know, the organization in Massachusetts, which is patterning itself on the NICE program in the UK. I mean, this would also be a way, so under a single payer system, this would have to come in because it'll be an additional way of denying care to people by determining, if you're not worth that, then you're not going to get a drug or a treatment that costs more than what we've determined you're worth.
One last question about the American system versus the other countries. You hear these statistics about how much the life expectancy in Canada and UK
Right.
as compared to the United States. And that can be misleading.
Definitely. So the two things are life expectancy and infant mortality. You're
Yes.
always hearing, like on infant mortality, that we have a very low, we have a very high rate of infant mortality.
And oh, by
compared
the
to-
way, the state of Georgia has the highest.
Oh, okay. Well,
Embarrassing.
but the thing that, when you're comparing the United States infant mortality rate to that, say, in France, you have to compare apples to apples. We have very highly developed neonatal units in this country, and a baby has access to the latest treatments and ways to keep that baby alive. Tiny, preemie babies live in this country. If you are in France, a baby is considered a live birth if it weighs a certain amount and is of a certain length. So many of these babies don't make it in France or in Germany do make it here, and so you're not comparing apples to apples because the system of measuring infant mortality are different. And on life expectancy, you'll say, well, the life expectancy is declining in this country. It's down to 79.2 years. But you have to look at what makes up life expectancy. The issue is that the United States has the highest level of deaths from car accidents. Obesity is a big thing. On a per capita basis, we have the highest number of deaths from guns and things. So, you're not, in other countries, they don't have the deaths through car accidents at the level that we do. They don't have deaths from guns. The United States has a very serious problem with obesity, but you don't see that in many countries in Europe or in Canada. But many of these people who are very obese, it leads to many medical issues and in some cases a shorter lifespan. So you have to compare, apples to apples in all of these things. And I think if you look at the cancer survival rates 5 years out, whether it's pancreatic cancer, whether it's colon cancer, whether it's breast cancer or prostate cancer, we have the highest survival rates from the World Health Organization's stats, from the Commonwealth Fund. We have the very best, and we want to build on that. We don't want to have to, go down and become like a third world country.
One last thing, and you talked about this earlier, the onset of these programs of Medicare for All. What does that look like? How does that work? The Sanders plan, the Jayapal plan, if they were to implement Medicare for All, and would it be suddenly or over a period of time, or?
Well, we don't know, but Bernie Sanders did say recently, when he was in this huge debate, he and Elizabeth Warren are like at loggerheads right now. You're a liar, you're a liar. Well, Sanders said, because she said she would introduce the Medicare for All in year 3 of her presidency. He said, I would introduce Medicare for All in the first week of my presidency, because you don't want to be stalling and taking time, because then there'll be all kinds of complications. So he wants to just take over the whole healthcare system immediately, ban all private insurers, people would be out of work. Who knows, how would doctors get paid? How much would they have to expand the bureaucracy to get people to have people doing billing in the federal government? I mean, if you ask people, do you like the post office? No, I use FedEx or UPS now, but people have a choice. Some people will use the post office, but people have a choice of the private system, and that there's a reason that FedEx and UPS and DHL are in business. What these people want is to get rid of the DHLs and all of that and just have government be in charge. And that makes me very nervous when I go to when I think about the DMV or the post office. Are those going to be the kinds of people that are going to be making decisions about my health care, about your health care, about how doctors are going to be paid, what they will be paid, and if they're not paid, what they're worth, that's a problem.
Okay, we've established this premise now about Medicare for All. We obviously know the American people aren't going to put up with this.
Right.
This is not what they want. What will work? Now, conservatives often take criticism that you don't have a plan. And we do have a plan, but
We have to communicate it.
we do. Tell me what works. Tell me
So-
how we fix this system that at the beginning of the book you said the healthcare system is broken.
Right. So we want universal coverage, and that will come through competition and choice, empowering doctors and hospitals.